Attention. Welcome to the Different Spectrums podcast. We dive into the wild world of mental health discussions. Get ready for profound talks, a sprinkle of humor and sarcasm, and a touch of colorful language. Just a quick heads up, our show reflects our individual opinions, which may not align with the standpoint of the podcast, our featured guests, or any related corporate entities. Our mission? To illuminate through laughter and satire because everyone needs a good chuckle. Chill out and don't stress over the small stuff. Legal troubles? No, thank you. Cancel culture? Please spare us. We'd rather keep this space lawsuit free. So buckle up, have a good time, and join us as we navigate the vibrant realm of mental health on the Different Spectrums podcast. Today's episode is sponsored by BetterHelp. BetterHelp connects you with a licensed therapist who is trained to listen and give you helpful, unbiased advice. By using our link, you can get 10% off your first month of therapy. So, Naz, as a therapist on BetterHelp, what has your experience been like?
I've been doing it since January of 2021, and it's been really fun and exciting. I've been able to reach clients all over the United States and the world. I've had good relationships. I've had folks that I've had for a couple months and a good handful where I've had for almost 2 years now. So it's magnificent. I've enjoyed my time and my clients. I love them.
Awesome. You can do it all from your phone or computer via phone call, video chat, or messaging, however you feel the most comfortable. Let BetterHelp connect you to a therapist who can support you, all from the comfort of your own home. Visit betterhelp.com/DSP or choose Different Spectrums podcast during sign up and enjoy a special discount on your first month. Hey everybody, we back again.
Hey, we back and we're live.
I'm Spencer, your co-host, and that's of course our licensed clinical therapist, Naz.
I don't endorse murder, but Dr. Nas.
There we go. Also, remember, don't take us too seriously.
Or do, that's completely up to you.
And don't forget to run up those likes for us. We'd really appreciate it. So, today we have a special guest. Our guest is a licensed clinical and forensic psychologist with over 20 years of experience. Based in Miami, she has her own private practice called Rise Psychological Services, specializing in assessments, dual diagnosis, and severe mental illness. She shares her expertise on topics like narcissistic personalities and serial killers on podcasts and YouTube. And she has her own show called World's Most Evil Prisoners on Amazon. So go check that out. Please welcome to the show, Dr. Lina Haji. Welcome.
Thank you. Thank you so much for having me. And I should clarify that World's Most Evil Prisoners isn't my own show, but I am in about 5 or 6 episodes. But I'll take that.
Look, you pretty 5 or 6 episodes,
Hey.
Like what, out of 10? That's pretty. That's
Out of
a
8,
lot.
10? I mean, and then let's be honest, you steal the show. So you're the star,
Yeah,
We got to protect our brown women. You got to gas yourself up. This is my shit. If it was a white
That's
guy,
right.
he'd be like, this is mine. So I just let you know.
That's fact.
Yeah.
It's very interesting you say that, because when the media company found me, they said that they had been looking for a minority woman forensic psychologist, and they kept only finding old white men. And that was what drew them to me. And I was like, finally, thank you.
Finally. Yep.
Made it.
Well, DEI, you're a DEI hire. It's good to know.
Oh my God.
DEI hire. I'll take it.
Either way, you know what? I think it's just something more to come, right? You're going to have your own show one day. You'll probably have us on just for our impressions of serial killers, and then we'll go on from there.
Yeah. You might have your own serial killer partner, if you try, because I know you're attracted to him. So, I mean, you're not attracted, but, infantilized. I'm going to stop using words.
You got visits.
I'm clinically attracted to them. That's accurate.
Clinically. Well, am I aroused right now?
Wait a minute. Hold on.
All right.
Anyways, thank you for coming on. Today, we are going to be doing the movie Silence of the Lambs. Yes. Dr. Lina Haji's personal favorite.
Yeah.
We're going to be talking about a few different things, such as we're going to talk about psychopathy. We're going to be talking about how serial killers don't have to have one type of mood or emotion. They have multiple emotions, just like anybody else, and they can come in different forms, like we're seeing in this movie. We're also going to be talking about the differences, right, between Hannibal and then also Buffalo Bill. And then we're going to be talking also about how, even though Hannibal is contained, he still holds all the cards. Nas, anything before we get into the show?
Well, we might actually have a visit. We might actually have Buffalo Bill come on the podcast. But Buffalo Bill, you there? You hanging out with us?
Hello, this is Buffalo Bill. Is she a great big fat person?
But Buffalo Bill, you sound aroused right now. You doing okay over there?
I got myself tucked right now.
Oh, okay. Well, I'm happy for you. You know, living the dream 2025. We accept everybody. So
That's so good. That's so good.
Thank you.
Very good.
Cheers.
Cheers.
So interesting pod today. Obviously, we're going to pick your brain, and it's fun to watch your brain start like spinning the wheels, right? And like how you're dissecting this, but also enjoying it and admiring the intelligence of Dr. Lecter in the movie. And so this is what I'm gonna poke some questions at, and why other people might admire it or like wear the costumes and like really love the movie, right? Also about this control. And I think a lot of people that are highly intelligent or gifted, they do hold a lot of control. And this might help some other folks that are neurodivergent that may be more naive, autistic, right? Naive to when people are doing manipulation or games or cons and how they can maneuver right around you. Because our population that listens to this podcast is most likely the victims of people's manipulation and not usually always the aggressors. The reason why I mention that is because a lot of these characters are autistic coded. Or, you know, there's some similarities in psychopathy and autism. Obviously, they're completely different, but people will lump some shit in there. The reason why I also bring this up is because Anthony Hopkins is quoted as right being diagnosed as autistic. So I think that's also another cool thing to talk about. But I'm excited to talk.
I actually did a reel recently on my Instagram about somebody asked me what's the difference between autism and psychopathy. And I talked about the similarities and the differences in how they are actually extremely different.
Yes.
So why I understand that laymen would think that they're similar. Do you know what I mean?
Yep.
You get it.
So I want to go into maybe touch on that, and like hopefully we can get to some things. I feel like this might be a longer pod because Doc can talk, and no shade at other folks, but like, you know, we got some stuff to dig into, and this is something when no one else has had expertise in. We've had many folks. Interesting thing that just popped in my brain, Spence. Why is it always women of color that are working in these prisons? It's only women of color that we know.
True. A lot.
It's only black and brown folks, which is fucking interesting.
Well, it really depends on, you know, I've typically worked in prisons that are close to urban areas. So that makes sense. And in Florida, particularly, which I'm a New Yorker, so I don't claim Florida. You know, New Yorkers have to tell people they're New Yorkers. In Florida, the correction officers who I will say I respect, you know, correction officers, it's a very difficult job, a very stressful job. But unfortunately, you have a lot of corrupt, poorly trained correction officers because the pay is horrible.
Yep.
The respect is horrible. The training is horrible. And that varies. I'm digressing a little bit, but it varies drastically from state to state.
I believe it.
Yeah.
I believe
drastically.
it. Because I know a few corrections officers, but I know and I get it because I'm a therapist, but I know it's mostly black women that I know that go into these fucking prisons that are doing the counseling.
But if you go into like prisons that are in the middle of like nowhere, like Mississippi,
is it white?
Oh yeah, Northern Florida is all white.
All white.
I have had some of the most racist encounters in my life in Northern Florida prisons. Correction officers being all white, staff being all white, and inmates being low socioeconomic brown and black populations.
I ain't gonna lie, man. To be in prison is terrifying. To be in a real racist or real white prison as a brown person, that sounds like the worst of the worst. But I ain't gonna lie.
100%.
That's literally probably hell on earth.
100%.
So interesting stuff. I can't wait for Pops to hear this conversation. I'm sure he'll be intrigued. Let's bite into this. As is in a tasty upper lip. It's Hannibal.
Unintended. I caught that one. I like that.
I'm
The
a
fava beans, the Chianti. I got it.
I didn't want a little taste. You lose a tasty motherfucker, dude. Look him up. I was telling a student the other day, because on one of the questionnaires for autism, it says, "Do you use your tongue for kissing?" The student was like, "Why would you ask that?" Well, there's a lot of sensitivity issues and sensory stuff with some folks. And so I always like to say, when you're attracted to someone and you want to taste their face, I'm like, that's a very autistic way of doing it, but that's what you're doing. You're tasting like their mouth and the face and saliva. I mean, it's a very cringe way I say it. It's always fun watching autistic people or neurotypicals like cringe when I say that. I'm like, hey, tastes like chicken.
Hello.
So good for you. Okay, let's get into the show.
Jesus. Right, whoop, whoop.
Whoop, whoop. Say whoop, whoop. Say whoop, whoop. Thank you. There you are.
Big.
Now I know.
I need you to do your best Rosie Perez imitation and then say whoop, whoop. Oh, whoop, whoop,
I don't know that I can totally do Rosie Perez, but I can do a typical, Puerto Rican short girl. Whoop, whoop. Is that good?
That was so fucking good. Holy shit. Also, you're canceled, so.
I'm so canceled now.
You're so canceled.
Oh my God. Like all my best friends are Puerto Rican. So
you thought season 3 was going to come out?
Yeah.
You thought.
But you owe us money, motherfucker. Specifically the white guy.
No.
Which one? That one.
That one.
That one.
His name is Jeff.
Let's get into the show.
I smell your cunt, by the way.
Good morning.
Dr. Lecter, my name is Clarice Starling. May I speak with you?
You're one of Jack Crawford's, aren't you?
I am, yes.
May I see your credentials?
Certainly.
Closer, please. Closer. That expires in 1 week. You're not real FBI, are you?
I'm still in training at the academy.
Jack Crawford sent a trainee to me.
Yes, I'm a student. I'm here to learn from you. Maybe you can decide for yourself whether or not I'm qualified enough to do that.
That is rather slippery of you, Agent Starling. Sit, please. Now then, tell me, what did Miggs say to you? Multiple Miggs in the next cell. He hissed at you. What did he say?
He said, I can smell your cunt.
I see. I myself cannot. You use Evian skin cream. And sometimes you wear lead at home. But not today.
Did you do all these drawings, Doctor?
That is the Duomo scene from the Belvedere. You know Florence?
All that detail just from memory, sir?
Memory, Agent Starling, is what I have instead of a view.
Well, perhaps you'd care to lend us your view on this questionnaire, sir.
Oh, no. You were doing fine. You had been courteous and receptive to courtesy. You had established trust with the embarrassing truth about Miggs. And now this ham-handed segue into your questionnaire. It won't do.
I'm only asking you to look at this, Doctor. Either you will or you won't.
Yeah. Jack Crawford must be very busy indeed if he is recruiting help from the student body. Busy hunting that new one, Buffalo Bill. What a naughty boy he is. Do you know why he's called Buffalo Bill? Please tell me. The newspapers won't say.
Well, it started as a bad joke in Kansas City homicide. They said, this one likes to skin his humps.
Why do you think he removes their skins, Agent Starling? Throw me with your acumen.
It excites him. Most serial killers keep some sort of trophies from their victims.
I didn't.
No. No, you ate yours.
You send that through now. Oh, Agent Starling, you think you can dissect me with this blunt little tool?
No. I thought that your knowledge...
You're so ambitious, aren't you? Do you know what you look like to me with your good bag and your cheap shoes? You look like a rube. A well-scrubbed, hustling rube with a little taste. Good nutrition's given you some length of bone, but you're not more than one generation from poor white trash, are you, Agent Starling? And that accent you've tried so desperately to shed, pure West Virginia. What does your father do? Is he a coal miner? Does he stinkle the land? And oh, how quickly the boys found you. All those tedious, sticky fumblings in the backseats of cars while you could only dream of getting out, getting anywhere, getting all the way to the FBI.
You see a lot, Doctor. But are you strong enough to point that high-powered perception at yourself? What about it? Why don't you look at yourself and write down what you see? Maybe you're afraid to.
A census taker once tried to test me. I ate his liver with some fava beans and a nice Chianti. You fly back to school now, little Starling. Fly, fly, fly. Fly, fly.
Welcome to Memphis, Dr. Lecter. I'm Lieutenant Boyle. This is Sergeant Patrick. Now, we're going to treat you as good as you treat us. You be a gentleman, you're going to get 3 hots to cot. Sir, if you sign right here, we'll have us a legal transfer. Here, sir, use mine.
Senator Martin, Dr. Hannibal Lecter.
Dr. Lecter, I brought an affidavit guaranteeing your new rights. You want to read it before I sign?
I won't waste your time or Catherine's time bargaining for petty privileges. Clarice Starling and that awful Jack Crawford have wasted far too much time already. I only pray they haven't doomed the poor girl. Let me help you now, and I will trust you when it is all over.
You have my word, Paul.
Buffalo Bill's real name is Louis Friend. I met him just once. He was referred to me in April or May 1980 by my patient Benjamin Raspel. They were lovers, you see. But Raspel had become very frightened. Apparently, Louis had murdered a transient and done things with the skin.
We need his address and a physical description.
Tell me, Senator, did you nurse Catherine yourself?
What?
Did you breastfeed her?
Now, wait a minute.
Yes, I did.
Toughened your nipples, didn't it?
Oh, son of a bitch.
Amputate a man's leg and he can still feel it tickling. Tell me, Mom, when your little girl is on the slab, where will it tickle you?
Take this thing back to Baltimore.
5'10", strongly built, about 180 pounds. Hair blonde, eyes pale blue. He'd be about 35 now. He said he lived in Philadelphia, but may have lied. That's all I can remember, Mom. But if I think of any more, I will let you know. Oh, and Senator, just one more thing. Love your suit.
Okay, precious, time for a little treat.
Hey everyone, before we get into the show, please check out our collaborator, Bubs Naturals. They sell a variety of health and wellness products, including collagen peptides, MCT oil powder, coffee, apple cider vinegar gummies, and other amazing products. Go to bubsnaturals.com and use our code DSP20 to get 20% off your entire order. And with that, let's get into the show. All right. And we are back again.
We're back. We're back like a fresh set of toes. You get them all buttered up, and you start to nibble on one, and you're like, "Oh, look at this little piggy with a mouth." And you're like, "This is a good thing, that motherfucker right out there right now." I don't know. Do serial killers like eating toes, or is that just me?
Are you not part of that population?
They could be.
They could. They might like eating other parts.
I mean, I think serial killers are just as varied as probably the general population.
Oh, look at you. Look at you.
Like a snowflake.
Come correct.
Which is funny because Anthony Hopkins actually was the voiceover for the Grinch. And was talking
really?
about, yeah, he was for the Jim Carrey version.
There you go.
He was okay, that's not all right.
All right. We're getting back on track. Let's get into the show.
Let's not talk shit about the Grinch.
Let's not,
right? We're a Grinch family.
I love a
here.
good foot. All right.
All right. So, like I said, we have the great Dr. Lina Haji on the show today. I've seen a few podcasts that you're in, and I know the background and kind of why you got into this, but I think some of our listeners would love to know, how did you get into this field and what made you keep on staying in it?
So yeah, thank you for that question. To be perfectly honest, and I like to help with the movement of destigmatization. I had my own struggles as a child. I struggled as early as the age of 9. And I remember my parents taking me from doctor to doctor. They kind of couldn't figure out what was going on with me. I had trouble swallowing and I wasn't eating, and they thought anorexia or, blah, blah, blah. And I went to neurologists, cardiologists, pediatricians, and nobody could figure out what was going on. And then, finally my mother took me to the Karen Horney Clinic, which is a very famous clinic in New York City. And it was the first time that a doctor had asked me questions that no other doctor had asked me, not to sound like a cliche feel-good story, but it really was like, she really cared about what I was thinking, what I felt, what I was doing, instead of just assuming and kind of throwing stuff at me. And I left that clinic with the first time in months with a little bit of hope. And I asked my mother, what kind of doctor was that? My mother said that's a psychologist. And I was like, sold. So I'm really fortunate because I knew at age 9, that's it. I want to be a psychologist. And then in later on, I went to community college in the Bronx. I took kind of a dumbed down forensic psychology class. It was called Psychology and the Law. And, I had always known that I wanted to work with underserved, underprivileged populations. My parents worked for the United Nations, and it was very instilled in me at a young age that you are to help people who are less fortunate than you. And I thank them every day for that, because that's part of my mission in life. And not because I'm such a great person, but because it just gives me a purpose, to be honest. And it was instilled in me. And so anyway, I took this Psychology and the Law class, and this really gorgeous woman comes in, young and together, and she's very well dressed. And all of a sudden she starts talking about serial killers and sex offenders and psychopaths. And in my mind, I always thought people who worked with that population were old white men. Yeah. I never knew that a young, attractive ethnic woman could do that. And I was sold again. And so then I knew from age 9, psychologist, from age 19, forensic psychologist. And that's where my journey took off. And I'm really, really, really lucky, because I know some people who are 60 and who are miserable with what they do in life. And that's my case. So I'm lucky. I'm really lucky.
Isn't it wild how much representation actually fucking matters?
So much, because I used to love watching Forensic Files and Dateline, and I know true crime is very popular now, but I've always been into true crime. And I sound like one of those rappers. They're like, I started rapping at 6. It's like, no, you didn't. But anyway, I was always into true. You know what I'm talking about. Anyway, I was always into
true I don't know what you're talking about. Is that what they say?
Rapping at 6, son.
Yeah,
son.
Have you watched when rappers get interviewed? They're like, so how'd you get into rap? Oh, I've been writing rhymes since I was 4 years old. And
well, calm your racism down. You could have picked any population. You're like, fuck those black guys. That's not what you said.
No.
I'm joking.
I'm from New York. Hip hop. I live and breathe hip hop. I know Wu-Tang.
Since you were 6?
Hey.
Wu-Tang 36 Chambers inside and out. Anyway.
Okay.
Wu-Tang.
Thank you. You get it.
Yeah, I know.
So, but yes, representation. The point is representation matters, because on all those shows, it had always been old white men. Always.
Oh. Yeah.
Just crazy how that can just spark an individual to just achieve everything, to follow their dreams and passions, to open up a doctorate, right? To go and achieve that. And we already know that's like less than, it's like 2% of the whole population in the US. You break that down into minorities or ethnic status, you're talking about less than a percentage, less than a tenth of a percentage. It's an awesome club to be in.
It's an amazing club to be in.
It's magnificent. And it's like, wow, this is pretty fucking cool.
Agreed. And it's growing, thankfully.
It's growing, yes. It's just cool that you seeing that woman can allow your mind to be like, oh, that could be me. I could be learned. I could be educated. I can be sophisticated, awesome, gorgeous, and do my thing, talk my shit without having to appease or be nice or soft, right? I can be brag. I can do whatever the fuck I want.
Yeah.
And so that's why it was magnificent for me having all these women as mentors in my life, but also my mom being a badass Latina. And by badass, I mean like she legit kill you. I mean, but so I only grew around very masculine women that were like, come at you. And so I just grew up with this thing is this is how you act. This is how you can do whatever the fuck you want. Go take it. And my father, go take it. But a lot of kids don't grow up with that. Especially a lot of other kids of color. They just don't grow up with that, where their family members are at a certain place or status or jobs or occupations or degrees, right? Especially when we're talking about immigrants. I love that was your story. I didn't know that was your story. That's pretty cool.
Thank you.
Yep.
Yeah. And would love to kind of piggyback off of that and ask you, since you're going into like these prisons, or you were going into these prisons and you're working with these inmates on a day-to-day basis. So really, how did you kind of, at first, did you have to like prepare yourself mentally to not get quote unquote like manipulated by like these different, people that are inside that kind of, that they want something, right? They want something from you, or they want something else. Like I remember you said that you had a story about how you were younger and then you would go out for a cigarette, and then like he asked for a cigarette and you weren't supposed to do that, but you gave it to him because, he was, like he had a disability. And so you gave it to him. And then the next day he came back and you're like, no, I'm not going to give you a cigarette. And he was like, well, I'm going to report you if you don't give me a cigarette. Right. So you're in this environment where people want something from you. Did you have to kind of flip a switch every time you go inside of work? Or was it something like, as time progressed, you're just like, I'm just getting desensitized to this?
First of all, thank you. I love Spencer. You're my best friend right now. No offense, but the fact that you did your research and you heard that story, those are lessons that I had to learn. I had to learn that lesson. I had to be manipulated, and I had to be played out. I had to be played in order to learn how easily I can be played.
You get hustled
and
nonstop.
I also want to say that I don't think all inmates are manipulative or have bad motives, but there's a secondary gain component in prison. They want psych meds, they want drugs, they want to get moved, they want to talk to a female, whatever it is they want. And I don't blame them. If I was locked up, I'd probably be doing the same stuff. So it's a combination of things. I had to learn those lessons the hard way. I think I had to have a lot of good supervision. And also one thing that I had to struggle with, especially with our ethical code, is how much authenticity and self-disclosure, especially in that kind of environment where it can be used against you. I'm a proponent that authenticity is actually a positive in a lot of ways. Dr. Naz, I'm sure you can relate to this. Being authentic and sometimes self-disclosure if it benefits the patient and it's in line with our ethical codes and all that, can be beneficial. But that's very hard in this kind of environment because you're dealing with dangerous people. So a lot of trial and error, a lot of trips and falls, a lot of supervision. And unfortunately, I will admit that the reason I stopped working in prisons in 2020, I still work in prisons because I'm a forensic psychologist, but working full time as a clinical psychologist in a correctional facility was because I was noticing that I was getting so desensitized that I was scared that I was losing my empathy. And the day that I stopped caring about my patients is the day I should quit. You know what I mean? And you'll have inmates yelling like, yo, doc, I'm suicidal. And you're like, bro, you're not suicidal. Like, we played this game last week. I'm not, and I talk to them like that. And I like talking to them like that because they respect my authenticity and the fact that, like, you see these psychologists in there and they're doing everything by the book. Dr. Nas, you've met those clinicians that they're very book smart, but they just don't know how to talk to a human.
It's like 90% of them suck.
Yeah,
I'm gonna be real.
Yeah. And it's like, so, you have this, not to racially profile or anything, but you might have a super book smart, Harvard educated, older white psychologist who's like, so do you hear voices? And it's like, that's not how that works. You got to be like, talk to me, tell me what's going on. Like, how are you feeling? Like, be a human first and a clinician second. And I think that the best tool in prison or any correctional facility is the gift of gab. If you know how to talk to people with respect, because at the end of the day, they can be inmates, but they're humans first. And some of them have done some really horrible, egregious things that you don't particularly want to talk to these people. But if you remember that they're humans first, and that you have to have solid boundaries, and you have to be consistent. So if you respect them, if you have solid boundaries and you're consistent and you consult or get supervision, you're going to be okay in correctional facilities. But it took a lot of trial and error for sure.
There you go.
Yeah. And I think also, kind of going along with that, it's, a lot of people, as soon as somebody goes into prison, all of a sudden they're not human beings anymore. They are a number, and they're not looked at as people anymore. And then once they get out, they're still not looked as people, because you can't get a job, you can't, can't get yourself back on your feet and stuff like that. And then so you go back inside prison because that's your life now. It's because that's all you can do. You can go back into prison. That's your job now. And that's an unfortunate thing, especially in the States, because I feel like I wish we could have something to where we could have a little bit of everything, where people can learn not to do bad things on the outside and inside. But then also we have something that we can learn and trade from, from those prisons and stuff like that. So
yeah, the economics get in the way, man, because you can't get jobs. So now you can't do nothing but hustle to get money, which sends you back to jail, prison. So it's a fucked up system. I remember being with my dad, like, you can't get no job. You get rejected from every job. So what are you doing? You're hustling. And so what do I end up learning? I end up learning about a lot of hustling shit. It is what it is. It's a vicious cycle.
I used to say that the system is broken, but I disagree. I think the system is working exactly how it's supposed to work, which is keep both socioeconomic brown and black people down. And you know what I mean? I used to say the system is broken, the system is broken. No, it's working how it's designed to work. They want you to recidivate. Don't get it twisted. They want you to recidivate. And don't get me wrong, I'm very big on personal accountability. I think people are responsible for making their choices and their decisions. That being said, Spencer, you brought up a really good point. You get out of prison, you haven't been given any coping skills. Maybe your drug addiction hasn't been addressed. You're still struggling with maybe symptoms of mental illness. You have no education, no job, no support system. And then you go back to selling drugs. Do I think that is okay behavior? No. Do I get it? And do I understand why our recidivism rate is so high? Of course.
Of course.
It's supposed to be that way.
Bad system.
Yeah.
How does one not get lost in like this thing called like sympathy that my boss used to tell me to stay in empathy? Because sympathy, I could automatically, like, I'm like, you're fucked. So what's the point? I would like, why am I even working with you? Because I would automatically be like, what's the point? You're fucked no matter what. So how does one stay positive and hopeful if you know they're going to, recidivism? How does one work on mental health shit in that sphere? I haven't really picked any of my homies' brains about this yet, which is interesting. I don't know why I haven't. How does one stay positive and grounded in the work that they do clinically if they're in an institution?
I think it's hard, because a lot of the times, like I was telling you guys off camera, people kind of say, how do you work with, psychopaths, serial killers, and sex offenders? And it's like, the inmates aren't the problem for me. Inmates are going to inmate. Inmates are going to inmate. I know what I signed up for. That's the population I chose to work with. It's the systems, the bureaucracy, the lack of resources, and the lack of support. That's the problem. So you're trying to help the most vulnerable, forgotten about population that nobody cares about. And it feels like you're pushing a boulder uphill, right? Because you just, you'll see an inmate do so well and say, doc, this is the last time, I'm never coming back. And 6 months later, you see him in the door and you're like, damn, you know what I mean? Like I thought you were going to make it. And yeah, it gets tiring. But what I've learned is that you have to break down the wins into small things, right? I'm sure you see this in your clinical practice too. Like maybe the goal isn't you don't ever come back to prison and you don't ever use meth again. Maybe the goal is you're in prison or you're a lifer, but you've reconnected with your mom and you write to her every day. Maybe the goal is you stop coming to mental health for suicidal ideation, and 3 months later, you're doing laps in the yard, and that sounds kind of sad, but you see some of the most hopeful people as well as some of the most hopeless people in prison. So you have to kind of pick and choose your battles and take your wins where you can get them. And also, I always think to myself, and this is going to sound a little bit narcissistic, but if it wasn't for people like me who actually care, if I just gave up and said, this is too hard, this is bothering me, and it messes up my own mental health, I'm just going to leave it, then why did I get into it in the first place? And who's going to be there? People like us who care, yeah, it's hard, but it's worth it.
Why do
And
you
every now
care?
and then you get that feel good story, somebody writing to you that you never thought you'd hear from again, who's like, hey, doc, I just wanted you to know I'm sober. I got a job. I got custody back of my kids. I've completed parole successfully. And you're like, damn, one out of maybe 100, but that's all, that's
fucking
enough to
cool.
get me to keep going.
Yeah, it's pretty cool. With this doing therapy with these inmates, and Spencer's probably going to get into some stuff here in a second. I'm going to do a quick pivot and then get back to Spence. Did you know that you wanted to work with, because we're doing psychopathy and Hannibal today. Did you know that it was a thing that intrigued you, that brought you in, or did you just want to work with inmates in general, or did you want to work with the people that doing a little bit more heinous things? Was that intriguing to you, enticing, interesting?
Initially, when I was very green and inexperienced, I really just wanted to work with the serious and persistently, the SMIs, serious and mentally ill inmates. It was very kumbaya. I'm going to save the world. I'm going to go in there. I'm going to save all the mentally ill ones, and I'm going to get all the people sober and all the people to take their meds, and then everything will be great, right? And then you get in there and reality hits you.
You're like, holy shit.
Yeah.
Ugh.
You're like, holy shit. Because you're like, what do you mean he had 30 vaginas in his freezer upon arrest? Like, true story.
I'm gonna just take a minute.
I mean,
Yeah, you gotta let the 30 vaginas set in.
I gotta let that set in.
Yeah.
okay, I'm gonna let it set in.
Mouth got a little watery there, but okay.
True story.
It's the truth though, right?
Yeah, no, true story.
30.
Dun, dun. He's got the meat.
Oh my God. Arby's week. Why? No, we can't make fun of this. This is bad.
Real inmate was
We've got the
arrested,
beef.
30 vaginas in his freezer. So there's that.
Yeah.
Don't worry, he's serving life. He's not coming back
Good.
out.
That's
Yeah,
good.
he's not
Jesus.
coming back out.
How does that not scare you, shit like that, man? It's wild.
I think, how
You
does
were
that not
scared.
scare me?
You had to be scared.
I mean, I'm not going to say there's never been times that
Yeah.
I haven't felt scared in prison, but again, even somebody who's as egregious as that and as high on psychopathy of that, 99% of these guys, you treat them with respect, they'll treat you with respect. You have your, I would say maybe not 9. You have your 5 to 10% that truly don't care, bitch this, F you, F that, pulling out their genitals, cursing, spitting, throwing feces. You do have your horrible guys that act like that. But again, these are humans, and the majority of them, you treat them with respect, they will treat you with respect. I've even shared a story of one time that I was caught in a riot between the Bloods and the Latin Kings, and the first people that came to my defense were not correction officers, they were other inmates.
Yep.
But they protected me quicker than the correction officers.
Yep.
And
Yeah.
that says everything about how they viewed me. Now, again, it's different. I'm not a CO. I'm not a correctional. I'm the psychologist. I'm the person that's there to help. Also, being a female sometimes is an advantage. They view you as a mother, a sister, a wife. They're kind of have that,
Kinship.
kind of protective, kinship or protection. So, but I would be lying if I said I've never felt scared or in fear in prison. But back to your original question, you go in there and you realize some people need to be in here. And that's an unpopular opinion, but some people need not be in society. They are psychopathic. They have done egregious things. They've inflicted a lot of pain and trauma on people, and they are exactly where they need to be. And then you have to kind of, just like everything else, just like any other place that you practice therapy, psychology, mental health, you have to individualize,
Yeah.
right? I hate when people throw everyone in a box. They're all inmates. No, they're not all inmates. They're all humans, and you have to individualize needs and treatment, right? Because like I said, a 45-year-old pedophile doesn't need the same kind of treatment as a 19-year-old kid selling weed who couldn't afford shoes to school. You know, the 45-year-old pedophile, he needs sex offender treatment, possibly in a more restrictive setting. He needs, you know, maybe he's antisocial. We don't know. The 19-year-old kid selling weed, and again, I'm not excusing anyone's behavior. I'm big on personal accountability. But the 19-year-old selling kid because he had no shoe, selling weed because he had no shoes to go to school. This is somebody who needs financial assistance, maybe an education, maybe a support system, maybe some kind of substance abuse classes. Those are two different individuals. They just happen to be under the same roof.
place.
One of the biggest mistakes that the prison system has, just lumping them all together.
Got it.
Yeah.
What other questions you got, Spence? I got one in the chamber.
Okay. I mean, I would love to talk to you. You talked about some, like, one thing that really also helped you get through working in prisons every day was also having humor about certain things, right? And, you know, when we talk about mental health, a lot of people think it's like a taboo thing to talk about mental health and humor at the same time. But that's how a lot of people get through the day,
Come on.
is having humor. And so, what is it about having that humor inside of these depressing, dark environments really helped you kind of get through your days while you were working in the prisons?
I mean, I think we just had a perfect example, right? If we really think about the fact that somebody was arrested and they had 30 female genitalia body parts in their freezer, there's nothing funny about that at all. That's horrific.
Yeah.
But
Yeah.
the way I said it, this guy had 30 vaginas in his freezer upon arrest. We all laughed, right? Because how else am I supposed to get through this?
Yeah.
You know? And
Yeah.
everybody, all my friends who work in corrections, we all have sick, dark, twisted senses of humor, but it's a coping mechanism. You know, if I'm not saying, you know, I wouldn't necessarily share my dark humor with people who don't work in the mental health field because, you know, Dr. Nas, they don't all get it.
No, a lot of them
And
don't.
you probably know too, Spencer, because you've been around long enough, but they don't all get it. And some things are better left unsaid. But, you know, if you don't make murder jokes and other inappropriate jokes, which I have to say this tactfully, murder is never funny. You guys understand what I'm saying. I hope you
Yes.
understand what
Yes.
I'm saying. But
Yes.
humor is a coping mechanism, and it's better to laugh than cry because sometimes it's so stressful and so horrible and so out there that, you know, if you don't find a way to reframe it and find camaraderie through humor with your workmates, you're not going to make it.
Yeah.
You know, so it's a tool we need to get through it.
Yeah.
100%.
And I will say, you're not working in like a jail where you get like a few DUIs and stuff like that. Like, you're literally getting people who are serial killers, murderers, rapists, sexual assaulters. Like, it's just
The worst of the worst.
Yes, it's a lot worse. And so with that, you do, like you said, you need that kind of coping mechanism to just get through the day, or else if you think about that stuff a little bit too much, it's maddening,
Overwhelming,
and it'll
bleak,
get to you.
maddening, bleak. Yeah.
Yeah. So,
And also what people, like, for example, I have psychologist friends who work with trauma victims. I personally can't do that because I'm too sensitive. So it's ironic. I can work with offenders because like I can separate myself more from the atrocities. When you work with victims of trauma,
A lot of empathy.
Do you work with victims of trauma, Dr. Nas?
Yeah, I got kids with a lot of shit. Yeah.
Yeah. So, right. So, but what people also don't understand is a lot of offenders are also victims.
100%.
Offenders are also victims.
Majority.
So then that's kind of even harder to wrap your head around because it's like, damn, you had such a fucked up childhood and so many people did such horrible things to you, but then you went on to do horrible things. And so it's this mixture. As a clinician, you're like, I want to be empathic, but you did such a horrible thing. And so, you know, there's a lot of, you have to consult with a lot of people and process and read and research and go on podcasts and laugh. You have to do these things or else you're going to go nuts. And also I have my own therapist. I don't have any shame in saying that. I have never, you know, if I miss one session, it's unwell. And I think that every clinician should have a clinician, at least at some point in their life.
Yeah.
Because we deal with a lot. And if you don't have somebody to bounce that off of, or you're not keeping yourself in check, then you're not going to be able to be there for your patients.
Yep.
You're not.
I would agree.
Yeah.
I would agree. My humor is exacerbated by the ADHD and the autism. So the autism leads into the very intrusive thoughts. And then the visualizations lead into the mimicking of old personalities from other people. And so my bosses have been reprimanding me multiple times, like, inside, that's you keep that thought inside, Nas. You keep that inside. And so today they were talking about case studies. If this girl or boyfriend just broke up with her via text and now she's suicidal, this and that. And I immediately was like, he was good looking, wasn't he? That's why she wanted to kill herself.
Yeah.
And so I held that back, but then eventually I said it. My boss was like, oh, but a bunch of people laughed. I was like, that motherfucker was Ryan Reynolds looking. That motherfucker eat him up, motherfucker. I want to kill myself too. Shit, Ryan Reynolds broke up with me.
But we get that.
Yeah, we get it. But it's a very professional setting. We're trying to do this training. And so I've been, told, shut the fuck up.
Yeah.
And then the nurse practitioner, psychiatric nurse practitioner, retired military, he's really morbid. And he's like, well, he was talking about pills, this and that. And I said, give me a couple of them purple ones, doc. And then all the admin staff, all these white folks, one other person of color that's just shucking and jiving for him, but whatever. They just get disgusted with me. And I see them talking and looking at me and snarling at me. But I'm like, everyone's going to sleep. This shit sucks. We fucking job's hard. I make jokes. Today I talked about cooking meth in the office out loud. I mean, I like to talk shit. My students like to talk shit. My students that are neurodivergent and autistic, great sense of humor. Magnificent sense of humor. Right. Every once in a while, you will have some that are very innocent, that are very gentle. And so we cannot say 30 vaginas because they will tweak the fuck out. Because the visual and things like that.
But as clinicians, we know how we
know where the line's at.
We try to, again, everything needs to be individualized.
So I love that. I use humor a ton. Without that, Spencer knows that I don't see the point of me even living or existing if I couldn't make people laugh or smile. So if I was to have something like Robin Williams, you're right. I couldn't, because my existence is this. So I agree with everything that you're saying. Authenticity, which you brought up earlier, is 100% a thing. A lot of folks of color are really pushing that. White women are kind of adopting it, whatever. But I ain't really gonna get into it. When we was in graduate school, we said, what population do you not want to work with? I said, white people who have money. And everyone was like disgusted because it was a room full of white women. And they were like, what about rapists and murderers? I'm like, I'll do it. I'll do it. Yep. I want to work with y'all. And they're like, oh my God. But I grew up around a lot of interesting individuals and a lot of different police and agents and murderers, and it's interesting. And you grow up and you're like, oh, so people are like, am I a bad person, Nas? No. I know what bad people look like, homie. You is not one of them.
Right.
So it's nice when you have lived experiences like you. Like if you were to have a client that has like OCD and like they have a lot of intrusive thoughts and things like that, you're like, homie, you ain't one of them, homie. Like, I know who they are. You are not them.
Yeah.
I had a conversation with a client today. It was magnificent. He's like, Nas, do you think my intelligence will lead me to, blowing people up? I said, nah, kid. You have the choice to be a monster right now, and you're not doing it.
That's right.
Right now, you already doing this shit.
Right, and the fact that you're asking that question means that you have insight into the fact that that's who you don't want to be. That's so precious.
Correct. But most kiddos, most folks, even inmates, I would assume, don't want to share that shit because they don't want to be hospitalized. Right. They don't want people to think they're going to kill themselves or others, right? So they'll hold that back. And that's what really gets in the way of therapists doing real work, Spence, is the stigma around suicidality and homicidality.
100%.
And everyone is a monster inside. You get pushed far enough, you're going to be a monster. Everyone's one bad day away from murdering a motherfucker. I'm going to be real. No, I would never. You don't know what the fuck you would do. So calm down. That's what my dad always tells me. You don't know what you would do. I got a question to ask, and then Spence, I'll kick it back to you. This is a fantastic conversation.
Oh, yeah.
So, all my friends, like I said, are women of color and are all gorgeous individuals. You also very good looking individual too, right? Girl, you ain't just a snack. This motherfucker's a dinner. Like, there wasn't no filet mignon.
That's right.
Some
Chianti.
Girl look like she got some nice toes. Let me stop.
Ah,
I can smell them.
The fava beans.
smell like cocoa butter.
I love some
What's
motherfucking
happening?
fava beans, bro. Them motherfuckers get stuck in your teeth and shit, the skins.
They
Oh,
do.
my.
They do.
Woo, the Arabs, we love them fava beans. Some lemon.
They're
Damn,
good with the lemon. With the lemon.
Yep. And 30 things in the freezer, tear it up.
Oh.
Let me stop. So that obviously is a brown individual. I know my body and where I'm at, who I'm talking to, especially with like clients of the other gender, of the sex. I'm sure you have to be aware of these things, being a woman in a prison system and being in American society's norm of like attractive. Yeah. So I know that has to play into some of your scheme of how you come at people and talk to people. I know you play into it, maybe you don't play into it, but I know you're intelligent to manipulate people. We call it therapize. But I know you got your swag, and I know you use your privileges or your oppressions to your advantages. I know you maneuver ways because I know you have that mind, because I've seen of what attracts you, mentally stimulates you. And if that stimulates you and attracts you, then I know you love the game. So I wonder how you operate in life in a prison system, but also being as an identified attractive woman of color. That has to be fun, cat and mouse, but I don't want you to get in trouble now, but like, I know it has to be
like,
amazing.
Don't be like Leroy.
First of all, I love the bluntness and the authenticity of this question. I actually thank you for asking it, because I've never been asked that. I've been asked similar questions before, but never to the cliff that you just asked.
They've thought it. They just don't want to say it.
You know what you do. You're manipulative, and you know.
Yeah, because when you said you're manipulative, I was like, I'm not.
I'm just an innocent little
I'm just
lamb.
a JT woman. Girl, I see you left. You could beat a motherfucker up too now.
Yeah. Ossifer, I didn't even know. So yeah, that.
I had to take my glasses off. I'm getting steamy and shit.
So first of all, I would like to say that I make it a point to go into correctional facilities as professionally looking as I can. And sometimes that means I have to, there's no red lipstick, there's no hoops, there's, hair is up, makeup is minimal. Only because, you don't want to bring, some people, and I'm sure you've worked with this outside of correctional facilities, some people, men want to bring attention to themselves.
100%.
And that's an unhealthy form of attention, right? Let's be real. So if you have good boundaries and you have good clinical training, you're going to know that's not the kind of attention I want to bring to myself. Don't be a freaking idiot, okay? Because I've seen women come into jails with breasts pushed up and stripper heels, and you're like, what are you doing? How did you even get past security? Like, what? They know what they're doing, right? Yeah. So I tend to go to the opposite of that, right? So I wear baggy scrubs, minimal makeup. I don't want to bring attention to, I wear sneakers, I wear flats. If a ride's freaking out, I'm running, I gotta be comfortable, and stuff like that has happened. But to be perfectly honest, I'm not gonna lie to you. Being a woman I've worked in female prisons too, but working in male prisons, I have absolutely used my gender and my appearance to elicit, how do I say this politically correct? To elicit information. To also gain trust. And maybe it is in a manipulative way, but the long-term goal is not manipulative. It's to kind of, because at the end of the day, everything you do, the way we're trained is supposed to have the patient's best interest, right?
Correct.
Now, we're human. So of course, shit doesn't always go that way. But if you check yourself as a clinician and you're like, what is my interest? Am I flirting with the inmate? Because now I got a problem. And now I need somebody to check me. I need to be honest about it. I've seen people fall in prison. I've seen high-level neuropsychologists lose their licenses over having inappropriate relationships with inmates.
My dad's told me about it. My dad's seen it and witnessed it.
It happens all the time. I mean, they run the correction officers, nurses, teachers. I've seen everyone fall to it. And even though I've worked in prison so long, every time it happens, I'm still shocked. I'm still like, what? Because like for me, the boundaries need to be so black and white. Offender, clinician. That's it. Or, not even in a correctional facility. Patient, clinician, black and white. And thank God I've been lucky enough to have those black and white boundaries for all the years I've been in mental health. But yeah, I'd be lying to you if I said I didn't use, my assets, if you will, or my gender, or some kind of charm, or anything like that to kind of build a rapport or get information that I want or navigate even my safety. You know what I mean?
Yeah.
I would be lying to you if I told you that wasn't an absolute fact of what I did. And any woman who works in corrections and tells you otherwise is probably lying.
They're bullshitting, or they don't know that they're doing it, but they're doing it. So everyone does this because you see every client that sees me, they see a certain view. And so I can lean into that and use that, right? If they're scared of me because I'm a large dude, right? I can lean in. If they see me as a jokester, a teddy bear, I can lean into that. If they want me, whatever, I can lean into it. And so I use that projection of who they think I am, and I can use it. Everyone does it. The reason why I asked you specifically is because not only I'm like, hey, I'm stating the obvious of who you are and your identities, but then also we're going to get into it in the clip when she's playing in and massaging his ego and like playing naive, but she's smart as fuck too. So she can hustle by thinking that maybe he's hustling, but then maybe he knows that she's hustling, but he's engaged. So he's just having fun. And I don't even know if he really cares about control in that moment. It's the reciprocity and jousting with someone's brain that is arousing, and maybe mentally arousing, 100%. Not physically, but mentally. And so then that leads us into some other delineations of sexuality. Yeah. When a lot of us that are autistic or neurodivergent, but also just highly intelligent people, they get the sapio or sapiosexual stuff they call it, right? And so it's just stimulating when you see someone and you're like, look at the resume on that motherfucker right there. Look at that. You know, they got that job. Look at that. They're a smart dog. Look at that motherfucker feet taste so good. Look at them.
What is up with the feet shit today?
I don't know.
What is happening?
I ain't ate in a while, bro. I'm hungry, you know. Right. I see him as little baby back ribs right now. That's what I see him as. They ain't toes, they're little ribbies.
All right.
They're like the little
Nope.
But it's got the texture of the McDonald's McRib though.
Why do you know the texture?
Yeah, know the texture of the McDonald's McRib. Nobody should ever have. First of all, McDonald's
and the toes. I would say the toes as well.
Oh yeah, you see, your focus is more important.
That's how I know your ass don't even care. He was just like, what did he say? He said toes. He ate a McRib. That's gross in itself.
No, it tastes. Yeah, you ate the McRib.
It is. I'm more concerned with the McRib than the toes.
Yeah, she don't care about the weird shit. She cares about the
desensitized.
She's so desensitized. So desensitized. Girl, you got to get out the profession. You got you got to go into teaching. You got to be around.
That's the thing. But would you be bored? Would you be bored?
She would.
Working?
She would.
Yeah, that's the thing. Actually, they're not stimulating enough.
Yeah.
She's not.
So when
danger.
When Nas said that he
play.
would not want to, that's a really good. When Nas was said that he would not want to work with rich white women.
Yeah.
When COVID hit and I was commuting a lot to work in this maximum security prison, I really got prison burnt out. And I was like, that's it. And for a short while, I worked at a very high-end prestigious clinic, right? And I want to put the disclaimer that I think that distress and suffering is subjective and that everybody is entitled to be affected by things that happen in their life in their own way. That disclaimer being said, when somebody came into my office and said, I'm so depressed, my husband took away my second Mercedes, I was like, I can't do this. This is not for me. I can't. I'm really depressed. My Starbucks shut down. I was like, I can't. I need a schizophrenic rapist to get through the day. I can't. It's just not.
How many vaginas you got in your closet? Not you.
I think it's the opposite.
Your clients.
I think it's the opposite, actually. I think we got them.
You got them shipped to you. What's that shit called? That fresh green fresh green. Simply Green or whatever it's called. You get them shipped to you, motherfucker.
Simply direct.
I can't.
Bro,
and that's kind of mean because I did have judgment, like, oh, what a high-end problem, kind of roll my eyes. Yeah. And then I was like, you know what though, Lina, maybe, this just isn't the population for you. And then I went back to forensics and I don't want to be dismissive of people's subjective distress. Correct. It just wasn't for me.
Not for you. You got a different passion.
And that's the thing. It's like once you're in the dirt, like once you see like all the grimy things that you've seen in like your work history, all that other shit just doesn't matter to you. No. Like, to at least on your level of clinician, because you're just like, you're not even stimulating enough. Like I could solve that problem in like 5 seconds. Buy another handbag. I don't know. Like,
Give me $30. Let me
yeah,
hold your purse, girl.
like it's nothing. Because when you do, and that goes for a lot of people just in life in general. It's like once you see certain shit in your
Yes.
life, that other shit is just extra. And you don't
Yes.
It's a privilege.
see it as anything. Yeah, it's
Yeah,
privilege.
it's a privilege. And I don't think it's a clinician specific problem. I think, we as
It's
a
everybody.
society, no, we over pathologize and we over, people are using the word trauma too loosely. And I digress because we could go into a whole nother, I'm traumatized. No, I've seen, and again, everybody's traumatic experiences are different, but I've seen trauma that I've seen trauma that you can't even
comprehend.
Yeah.
Real
So
shit.
I go on Instagram and I see the therapy speak and the over pathologizing and the, distress for privileged problems. It does irk me. And it's not clinician specific.
Right.
It's human specific.
Totally.
Like, bro, please, that's not a problem. And that sounds judgmental. And it is.
It is. Hey, I mean, hey, you know your pitfalls and you know where you can go. For me, it's a betrayal because I know I'm good. And I know that no one can work with my population like I can. So if I don't work with that population, now I'm betraying them, but I'm also betraying myself. And I start to get their survivor's guilt. Because who else going to work with them?
Right.
Bethany's going to work with them? Get the fuck out of here. Bethany don't know ass from a hole in the ground, but she going to work with this person. No, get the fuck out of here. And so that leaves me with a lot of like anger. I mean, I'm angry at myself for being at the university level for so long because it's a lot of privileged students. Not all of them, but a high rate, right, of kids. And it sucks because I was supposed to do something else and then it pivoted, which is magnificent because it's helped me out in my life. But now I'm like kind of resentful and angry. But I'm glad that I'm stopping it and not going any further with it and moving up the chain. You get angry. I remember I was about to be the director of Michigan University and they asked me some questions like this. And he's like, how are you going to feel about this moving into this big administration role? I said, I don't know what you're asking me, homie. Like, be for real. Like, stop beating around the bush and being on the fucking, I'm going to say the word, being a little bitch. Like, be a man and ask me what you want to ask me. Yeah. Are you asking me, am I going to be angry at myself from leaving all my students because I care about my students more than anyone else? Yes, I've processed that. I've been angry. I'm mad. Right. I'm sad about it. But I know what I got to do.
All of it.
I got to change the system more, and I can't do that as a low-level clinician. I need to go up. And a lot of people don't like the way I talk. And so that's why me and Spence talk about being autistic or neurodivergent or blunt or of color or a woman of color, God forbid, and how they look at us in interviews and like, nope, not you. You're too smart. You talk too much shit. We can't control you. So we're going to hire Bethany, who's going to be a good little girl, know her role, shut the fuck up and just fit in. Well, a lot of us can't do that. A lot of us won't do that. A lot of us don't want to betray ourselves more than we already have. As that scene in Andor says, what have you sacrificed? Everything. I use the tools of my enemy to succeed in life. And I don't even know if it's going to fucking help or if I ever see the wake of the morning. Like this one scene in Andor, like it's fucking one of the best in Star Wars.
It is. It's like probably one of the most used scenes on like social media. It's been ever since it came out. It's amazing.
Bro, the
it's
tools of my enemy. I've been using that for a lot of my immigrant women because you're using the tools of the enemy to fit in this white society.
No, I agree with you 100%. And even though I'm not neurodivergent,
Girl, you ain't normal. I'm gonna be real with you.
No, I ain't normal. And my mouth, my whole life, my mouth has gotten me in trouble. But at the same time, my mouth has also been a huge role in advocacy.
Yep.
You understand what I'm saying? And so I take risks every time I come on a podcast because I'm supposed to be Dr. Haji and I have to testify in courts and I have attorneys and judges and very, politicians and people that look at me as you're supposed to be the forensic expert witness. And then you're going on, you're talking about 30 vaginas. And so it's a risk. But at the same time, I can't live my life, there's limits and there's boundaries and I adhere strictly to my ethical code, which I always will do no matter what crap I'm talking on a podcast. So I think that's number one. Number two, I think authenticity is required to live a peaceful, serene life. I can't go in there like you were talking about, Dr. Nas, and be somebody that I'm not. And advocacy is in my blood. And so, and I'm not saying I advocate outside the parameters. I'm not saying I never have, but outside the parameters. But like you said, I'm already coming from a one down position. 2 down, 3 down, you know, whether it's you're neurodivergent or
Yep.
you're a woman or you're I'm an immigrant. I wasn't
Or
born
you're
here.
immigrant, whatever. Yeah.
You know, or you're a person of I'm mixed, or you're mixed. We're already on you know, coming down. So for me to come up and be like, I'm Dr. Haji, take me seriously, but yet I'm on this podcast talking about whatever I'm talking about, it's like I'm taking a big risk. But to me, it's worth it because I sleep well at night. I do, you know.
Good.
I do.
Yeah, you ain't ADHD and autistic enough if you sleeping good. We ain't sleeping good over here, homie. Yeah.
But, well, I mean, I didn't say I sleep at night without the aids of something.
Oh, hey,
Glug.
is it me, bro, or is it every time she mentions? I'm not going to use the word again, but every time you mention the 30 things,
The JJs.
I see them wrapped in like a McDonald's wrap. Like they look like little Big Macs. Like they look like 30 Big Macs in my freezer. It's not even a vagina.
Hungry.
It's just a Big Mac.
Well, okay, so I've gotten this
Got that
question.
special sauce.
I don't know. Have you guys ever watched Louis C.K. stand-up specials?
Yeah. Oh,
yeah.
not stand-ups, but yeah, go ahead.
Okay,
Yeah.
because one of his stand-ups, he's talking about how he's in traffic and somebody says, suck a bag of dicks. And he's like thinking, like, what does a bag of dicks look like? Are they all like smushed together in a plastic bag, or are they all standing up in a brown paper bag like baguettes? Right? He was
Oh my
like,
God.
yeah,
So
no,
good.
I'm gonna
Yeah.
I'm gonna send you this bit as soon as we're done.
Go
So
for
he's
it.
like, what does a bag of dicks look like? And I feel like you're having the same.
That hyper visual. I feel like for me, the bag of dicks would just be like a bunch of them and like a big meatball. It would look like a big meatball.
Well, do you want?
big-
I can give you the answer. I read the arrest report. I can give you the answer. Or do you want to just
Of
say-
what the JJs look
Yeah,
like.
I-
is
No.
what you're saying.
I'll literally, it'll
I would
traumatize
ruin it,
me.
right?
No,
I would ruin
no,
it.
it wouldn't ruin it. This is like a very like Big Mac thing. This is
Okay,
like
so I
fun.
won't tell you. I won't,
No,
okay,
no,
my
no.
bad.
My mind is very graphic and the autism
Okay,
and the
I
hyper
won't tell you.
empathy
I
kicks
won't.
in.
I
Yeah.
won't. Okay, but I do know the answer. I read the arrest report, but I won't tell you.
No, I don't need. I've read enough for arrest reports. No,
Okay.
No. Okay.
My
own.
God. Yes, I
How'd you-
did do that.
He was nibbling on the toes. What?
He wouldn't stop.
He beat him to
Nibbled.
death and then nibbled. Let me stop.
He put Big Mac secret sauce on
That
him.
Polynesian
what does
man.
that mean? What
Yeah.
does that mean?
Racism.
Anyways.
In that arrest report. Racism.
Yeah, racism.
Yeah.
Racism.
They pigeonholed me, man, in that
but-
report.
I do want to
Go
go
ahead.
back to like what you said. Would love to ask you. So you talk about having like a relationship with like, your patients, clients, and how it's more black and white, or you want to keep it that way, just for just for the sake of like having that relationship, just have it black and white. But the action of therapy itself is a gray area, and you have
Sure.
to stick in that gray area, or else you can come off as unauthentic, and then why would I talk to you if you're
Totally.
unauthentic? So would love to know, like, what are your thoughts on like just keeping that gray area, but then also making sure that your relationship is black and white as well?
Yeah, I think that's a great question. And I think that that's a great question for any clinician who works in any kind of setting with any patient, right? Because you want to be authentic. And there are times where I've really wanted to self-disclose because I lived, my life has not been straight. It's been zigzag. And I've had a lot of my own experiences. And there's been time where they're like, especially when they're trying to test you, you don't know what that's like, doc. You don't know what that's like. And you want to be like, actually, I lived in the Bronx for 7 years. Let me tell you that I know exactly. But you can't do that, because that's not how we're trained.
Yeah.
And you have to go back to your training and your clinical skills. And not everything is in the book. Also, I don't think the best therapists are just doing what we learn in the book. I think the best therapists, I'm sure you can agree with this, Dr. Nas, is those who can build genuine rapport and alliance. So when I say it needs to be black and white, I'm strictly talking about like ethical boundaries, right?
Yes.
You are unfortunately incarcerated and you are my patient, and I am not incarcerated and I am your clinician. That is black and white. As far as the rapport and the alliance, that, like I say with everything else, needs to be individualized. I'm not going to talk to a very, very dangerous, potentially still violent serial killer the way I'm going to talk to an autistic juvenile delinquent who is experiencing depressive symptoms in juvenile detention center. And any clinician who does talk to those people the same way probably shouldn't be a clinician.
Yep.
So it has to stay gray. I think it has to be gray. There's no other way. It has to be gray, and yet the ethical confines of my profession have to be black and white.
Yep.
Yeah.
That makes sense.
Totally.
So Spence, I'm going to kick out an idea real quick, just between me and you. I think we're going to do this in a 2-part series because it's a magnificent conversation and it's going to be close to an hour. So I'm going to do this as a 2-part series. I'm going to do it as an interview for everyone that's paying attention to this. And then me and Spencer will do a promo for it. And then we're going to actually do the actual movie breakdown because I feel like that's going to take time. So we're going to do a 2-part series, 2 episodes, release them in the same week, not 2 separate weeks. That way people can ingest it in a little bit more palatable ADHD like experience because they're all neurodivergent as shit.
Oh,
So
I
just as a
feel
heads
like, I
up.
feel like it took up too much of you guys' time now.
No, this
has been perfect.
Bruh.
Yeah, no.
You know.
When we can have just conversations and just not only just have serious conversation, but then also just bullshit around a little bit.
We've never
That's
had
the
anyone
best.
with your mind. So this is a different mind for us to like ingest.
Compliment or insult?
Maybe a little bit of both.
No.
Maybe.
Why would it be an
No, I'm
insult?
just playing.
I'm like, this motherfucker, you got all the, what did he say in Brooklyn Nine-Nine? Oh, I'm not going to say that.
Yeah, there you go.
No, because
You
he
know what,
said,
Naz? You said you were working on your filter and you're doing so well.
Yeah.
You said
Yeah.
I'm not going to say that like 4 times now. I'm like genuinely proud of you.
You
because
literally compared some toes to a McRib.
I know, but
That's
he's
texture.
also said I'm not going to say that like 4 times. So good for
because
you.
in the show, he's like, my brain is hard.
He's about to say it.
It's rock hard. And he's like, and then the Captain Holt, he's like, that's wrong. Your brain is like soft and wet. And so I was like, you got a moist brain.
He said it. He couldn't stop.
But I didn't
Nope.
mean it that way. But people are
See,
going
that's
to
where he
think
gets
that I
in
mean
trouble
it.
right there. He's like, I won't say it. I
People are
won't
going to
say
think
and
that
then
I
he said
mean
it,
it as
yeah.
a pervert.
By
I'm
the
not a
way.
pervert.
By the way.
I'm not a pervert.
I'm not a pervert. All right? I'm not a pervert.
I'm not a pervert.
Oh, that was good.
That was French. I was trying to do Arnold, but as a French.
Oh no, my mother's French. So she's been living in
See.
for 40 years and she still talks like this. So yes.
So,
French
so
is actually-
can you speak a lot of languages?
I feel like you
Only
can.
French and English. French was my
Oh,
first language.
okay. I mean, hey.
My dad spoke 9. My dad spoke 9. He was a freak. He was in Mensa. He might have been on the spectrum. I don't know.
Girl, you ain't normal. Let's be real.
Yeah, no, I know.
Yeah,
I know.
I know.
You,
I know.
you closer to our side
That's a
over
good
here of the
thing.
bridge. Yeah.
Oh,
You're close.
that's why
It's
Dr.
empowering.
Mac and I get along so well because she's always like, "Are you sure?" And I'm like, "Yeah, it's
No, she
I'm a
ain't
bell.
normal.
I love she ain't normal, but she's so awesomely unnormal. But neurodivergent people are my people because
You
guys
fit
are
in
my-
with us because you're
I take that as a real like honor that you accept me.
100% because your appearance looks like you would not be part of our gang because you're more well put together. Because our gang is usually shown as like
look at us.
chaotic and weird looking and funny, eccentric, multicolored hair, right? The neurodivergent folks have a different vibe, even though they can be gorgeous and magnificent, but it's usually
No, I see what you're saying.
seen as
Like
a
Mac
different thing.
with the Spider-Man tattoo and the red hair and
Hey,
Flip.
Yeah.
I wasn't into all that, and then I met Mac. I'm like, now I'm like, oh, damn,
Hold on a second.
yeah,
Anyone want some McRib?
Oh,
she's awesome. She's
need
awesome.
some food. Need some food, man.
I'm at her toes.
Oh,
They got tattoos on them. I'm
why don't you ask her that?
I'm not gonna
All right.
ask her. Hey, by the way, Dr. Mac,
By the way, I was wondering, you got tattoos on
you got tattoos? Do they get hot in the San Antonio heat?
Oh,
Stop. So I got a couple questions because now we're gonna, like I said, we're gonna segregate this into 2 different things. So a question for you is, what would be advice? Because we're gonna do this lengthen the interview. What would be the advice for like women? Because right, it's a lot of women that listen to the pod when they're engaging with people. How can they help navigate any like maybe maniacalness, manipulation? How could they find out if someone is a narcissist or is sociopathic, antisocial person? How can they help navigate them? Do you have any advice for women that are listening today? Big question. I'm sorry.
That's a great question. So first of all, I think narcissism is used also too loosely.
I know.
A lot of people are egocentric or they're selfish or they're just assholes or they have narcissistic traits. But interestingly enough, the prevalence of narcissistic personality disorder, truly meeting the criteria for the entire disorder, is only 3% in community samples. So I think people confuse that with like my boyfriend cheated on me and he lies. Yeah, he's an asshole, but that doesn't necessarily make him a narcissist. But I digressed. When it comes to dealing with narcissists, antisocial, psychopaths, I think you need to, number one, try and figure out how much of the conversation and how much of the interpersonal interaction is about them or benefits them. So pay attention to that. If it seems like all of their questions, all of their interactions, all of their motives center somehow around their needs being primary, a little bit of a red flag, right? Because that could be antisocial, that could be psychopathy, and that could be narcissism, which are kind of in the same, cluster. Yeah. I think looking at things like, do they have poor behavioral controls or impulsivity issues, which, as we know, impulsivity and poor behavioral controls could be a sign of a million different disorders. I mean, it could be anything. It could be ADHD, it could be anxiety, it could be anything. But I think, also looking at kind of like social deviance in general. If you go out on a date with somebody and he's an a-hole to the waiter, he might just be an a-hole, but that should be a red flag. How does he treat people who can't do anything? How does he or she treat people who can't do anything for them in return? And I think that's not just human decency. I think that's also sometimes can be a sign of narcissism, antisocial psychopathy. Do they have long-term goals? Do they have other people in mind? Do they care about other people besides themselves? Do they care about you? I think those are some preliminary things to look out for. And then if you really still have some red flags, contact me and I'll give them a psychopathy assessment. It's not a problem. Oh, Google searches. Do your Google searches.
Do your Google. So how do you suss out, and then I'll be done and then I'll give you back to Spence. How do you suss out the difference between, we talked about in pre-production, and you said you just recently talked about autism versus, right, this psychopathy. Right? How do we, right, because this, you just talked about someone that's kind of coded autistic, right? They could be self-centered, talking about themselves, but there's this maniacalness in one versus the other, in my opinion.
And I think so, and you guys have a lot of neurodivergent information, so please correct me if I'm wrong, but I think I do actually do neuropsychological autism evaluations, and I do psychopathy evaluations. And so I think where people think that autistic, particularly children, might show signs of psychopathy is the lack of socio-emotional reciprocity, and sometimes the flat affect, or the inability to make eye contact, or the lack of paying attention to social cues, right? What's different with that is, again, it's neurodevelopmental. It's literally a neurological issue. So the socio-emotional reciprocity and sensory sensitivity and lack of social cues, awareness, poor eye contact, all of that stuff does not have a malicious intent or malicious component to it. It's just the way they are. Their brain functions differently. And to be honest, as you guys know, it's kind of cool. You know what I mean? Whereas psychopathy, the lack of socio-emotional reciprocity is not necessarily because they were born that way. It's because they're callous. They lack remorse. They lack empathy. They don't care. They are socially deviant. They don't have proper interpersonal interactions because they lack the ability to care for the other person. They only care about themselves. And you're not likely to see the other signs such as sensory sensitivities. That's not necessarily going to be there. You're going to see more things like, again, going against social norms or problems with authority, which I'm not saying these are mutually exclusive. That's the other thing.
Yeah,
I actually evaluated a 19-year-old child who was inpatient a couple weeks ago for a threat assessment because he was stalking his teacher, and it was a credible threat enough for the police to get involved. And he was on the spectrum.
Yep.
So he had some signs, some psychopathic traits, even though he was young, and I would never diagnose a child with psychopathy, even though it's not a diagnosis, but I would never say that they have the construct of psychopathy as a child. But he had they were overlapping. He had autism. He hadn't been neuropsychologically evaluated, and he had some traits of psychopathy. So, but that's just like with anybody else. You can have anxiety disorder and be a cocaine addict. You can have dyslexia and have cancer. You know what I mean? Like, again, everything needs to be individualized. Humans are individuals,
So all the stuff.
Yeah, all the stuff. But I think the main difference between autism and psychopathy is the motive. There's no motive in neurodivergent people. It's just how they are. In psychopaths, there's a motive. And it's to get something. It's to manipulate. It's to go against the grain. It's to get their needs met.
Okay. Okay. Spence, what are you thinking about as we wrap up the interview?
I think that this was a great talk.
Yeah.
Yeah. Yeah. It was a great talk.
A lot of stuff.
I do want to ask this because I'm curious as just a person. So there's always been that maybe myth or misconception, or maybe it's true fact about like serial killers and killing animals and stuff like that. Is that an actual thing, or is that just something kind of played up in like media and stuff like that?
No, that's a great question. So there are different theories behind psychopathy, and one of them is called the McDonald's triad, which is a little bit of an outdated theory, but there's still some research that shows that it's relevant. And the McDonald's triad consists of three things: arson, cruelty to animals, and bedwetting at an inappropriate age. And they used to say if you have those three components, you're going to be a psychopath when you grow up, or you have propensity to be a psychopath when you grow up. So do serial killers kill animals? Not necessarily, but there is a high percentage of serial killers, and I'm kind of using serial killers and psychopaths interchangeably, even though those are absolutely not the same things, because you can be a politician and a CEO and have no criminal history and be a psychopath. Let's be clear. But when it comes to serial killers, I think, I don't know the exact numbers, but a lot of them do have a history of cruelty to animals, which drives me. I'm an absolute animal lover.
Yeah.
So that is because, a true psychopath is going to start with more vulnerable victims.
Yeah.
So test on animals, and then maybe they'll get to humans, and then they'll get to serial killing. And so it's a progression of behavior, just like any other behavior that progresses, like drug use or, violence in general. But so you're not wrong. It is a real, cruelty to animals and children is a big red flag.
Mm-hmm. Well, psychopaths don't have empathy, correct? Or they do have empathy?
They lack empathy for sure.
So
they lack empathy. They're callous, and they usually lack remorse. And there's a lot of evidence that's starting to show that there's a neurological component where they literally just cannot.
The wiring is different. So that's why some of the research is starting to look at like maybe this is a neurodevelopmental thing in a different way.
But I think the model still points to everything else, which is mostly biopsychosocial, except for neurodevelopmental, which is, genetic or neuro, as they say, but it's biopsychosocial. So for example, the current school of thought is you can be born with a predisposition or a propensity to psychopathy. But as we know, if you're born with a predisposition to psychopathy, but you are raised in a nurturing, loving home, no trauma, no substance abuse, nothing like that, maybe you'll end up, as a CEO of a company. You'll channel those traits into something more socially acceptable and positive, or you'll be a politician or something like that.
Or
be president.
Or a president. And that is all I will say. Or a president. And because but the point is, you might not end up being a bad member of society because you've been nurtured, because the sociological, psychological factors nurtured that into a pro-social manner. Now, if you're born with a predisposition to psychopathy and you're raised in a low socioeconomic background with tons of abuse and substance abuse and violence and crime, and the chances of you becoming Jeffrey Dahmer, obviously they're going to go super up.
Yep. It's I feel like the Triple H music kicks on. Time to play the game.
Oh, I thought you meant X gonna give it to you.
No, Triple H. The game. Ha 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 ha. Yeah, that's immediately. I had a lot of those tendencies when I was younger, FYI. So
well, you might have had those tendencies, but it sounds like you also had some kind of nurturing. I mean, you've mentioned your father in a lot of ways that sounds like he had a very positive impact on you in spite of some hardships. So
100%. They were just surprised on how I used to I'm not going to get into the animal stuff, but there's a lot of animal stuff. So And the arson was definitely there too. But then again, my dad was an arsonist. So I mean, like, it's in the family. It's a family thing.
Yeah, and it's like I said, it's a red flag, but it's not a be all and end all. And we know that we can't judge people on one behavior. I did some dumb stuff that I'm not proud of in adolescence, in my 20s, that if you would tell me that this is where I would end up as an adult, I'd be like, no way. There's no way.
We've talked about it on this pod.
I surprised myself.
There you go. We've talked about on this pod. No one thought I would be here. Everyone thought I was a delinquent or a deviant. Everyone thought I was going to jail or prison. So, and then it's fun to look at their faces as you get older and they're like, you?
Yep.
You? I'm like, yeah, bitch.
Yep. Yeah.
Yeah. Fuck you. So an interesting thing is when we talk about this, there's a couple books that my boss made me read when I was with his first few years of work. One was called The Psychopath Next Door or The Sociopath Next Door. That's magnificent because it gets in all the, not just the murdery stuff, but all they always want to be the victim. And it's always so the psychopath always plays the victim Spence, and they manipulate you in a million different ways.
Totally.
So they don't have to work or to where they're hustling you. Right. There's some people that are, I'm not going to mention any names, but have DM'd us when Spencer's done the research. And he's like, they're a fucking Looney Tunes. Like, they're a psychopath. I'm like, yep. This is not borderline. This is full blown like sociopathy.
And there's a lot of research now going into, because when you think of psychopath, you think Jeffrey Dahmer, Ted Bundy, Charles Manson. Yeah. But now we're starting to realize that, as we just talked about,
the hustle game.
The white collar psychopath.
Yep.
Yeah.
Right? So you don't have a criminal record. You may not have never murdered anybody, but you damn sure have the same thinking as Jeffrey Dahmer.
100. You're running the game.
Yeah. I was in a philosophy class and we were talking about what would you do in order to get to the top or to be the best or whatever at work and stuff like that. And one of the students was just like, I murder anybody I have to get to the top. And I was just like, bro, you are just, this is, I even brought up to the professor. I was like, that dude's like crazy.
Yeah, like, he said it out loud, sir.
He said it to the whole class, like out loud. He probably knows who it is because he works at the school. So he probably know who it was. Mm. But yeah, no, like it was just, I just said, I was like, bro, if I have to like murder or kill anybody just to get ahead, then I'm no better than anybody else. Like I'm the worst of the worst. Because at that point, what's the point? Because I'm still gonna keep on doing it. And then once I get to the top, then what?
You ain't trying if you're cheating, though, right? And so a lot of people in this American society, they try a million different ways to cheat, whether it be PEDs, right? Augmentation to the bodies, faking their resume. I mean, there's a lot of cheaters that are winning, faking their followers. And a lot of people will sell their soul, Spence, to make $1. But that's not sociopathy. That's something else.
And clout is a hell of a drug.
Clout. Oh, boy.
Clout is a hell of a drug.
Notoriety is a reason why some of my students on the spectrum will really get suicidal. It's because they want to do something. They want to be Nobel Prize winning. They want to change the world. And when they realize that they're going to be mediocre, well, I might as well kill myself because who wants to be mediocre?
Interesting. It's very interesting.
I recently had a boy do that. So,
I'm so sorry to hear that.
Yeah, it happens. So life is fucked up for a lot of us, right? We start to realize what is the meaning, what is the point, what is the purpose, why am I here?
Right.
Where other people think about it, but autistic folks will get latched into it.
Yeah.
I mean, I'm just going to do this. This sucks. And even my ass, I'm like, this sucks. Why would this is bullshit. All right. So we're going to pivot in a different direction. So, but same. There's another book called, and I don't like this fucking guy at all. He's got TED Talks about being psychopaths and sociopaths. I wonder if you know him. I'm sure you do. So his book was called, Spencer, you're going to have to Google this for me, The Psychopath Inside.
I didn't read that one. Let me see who wrote it.
So he does a lot of the neural imaging, and he was studying him. He was studying a bunch of serial killers.
James H. Fallon.
Yes, and so his neural images. Yeah, his images for his brain actually got mixed in with his families and all that. Got mixed in with the serial killers. And he was like, "What the fuck?" So it turns out he has the brain neurologically as he imaged as a serial killer.
And really? That's interesting.
And so his entire book is trying to prove why he's not a psychopath. But then you look at all the horrible things that he's done in his life. And you're like, well, he could be bipolar, but he is like horrible. And the main reason why he says I'm not a psychopath or horrible person is because I've been nurtured and I've been trained. But the only reason why he's got away with everything in his book is because he's a white man, wealthy white man. That's it. It's the only reason why he got away with everything, wealthy white man. But he's horrible.
Oh, now I need to read this.
You need to read it. It's magnificent. There's a good section in it about autism too, neurologically versus psychopathy. He does a lot of TED Talks. The book was magnificent, and I fucking detest the guy.
I've heard of this guy, and I have a sinking feeling I might detest him too. One of the greatest books on psychopathy is by Dr. Robert Hare, who is the guy. He's actually the one who trained me on psychopathy. He's the one who made the PCLR, the Psychopathy Checklist Revised, which is the gold standard psychopathy test in psychology. Yeah, the PCLR is what I administer to determine.
Well, look at you name dropping.
Yeah. Yeah. Oh my God. I got trained by him like right before he retired. And I was like a groupie. It was like seeing Drake.
Can you imagine his mind?
God,
I know you were just infatuated with his mind. You were just sponging it up.
Such a dork. I was like, oh my God. I felt like seeing Michael Jackson. I was like, I love you so much. I'm that person. Like I go to forensic psychologist conference. Look over there. Like,
I know you geeked out. You went full tism.
Yeah.
I know.
Oh my God. Totally.
Full tism.
Totally. You gotta read his book. It's called Without Conscience.
Without Conscience. Spence, write that down.
Without Conscience. Dr. Robert Hare. So awesome.
Yep. You're like a puppy dog when its owner comes home with like big brains. I wonder, would you eat a brain? Like if you were Hannibal and you're like, this is a smart motherfucker, would you eat that thing? Or would you be like, nah?
I like my shit cooked,
But he cooks it in Hannibal. In Hannibal.
I need a little bit fried.
A little sear, like Spam.
Yeah.
It looks like Spam.
It probably is.
But it looks like it would be chewy.
Yeah. That's why you got to really give it a
calamari,
good sear.
like grilled calamari.
Calamari.
It probably is like calamari.
Right?
Yeah.
Like chewy.
Yeah.
Well,
unless it's fried.
Before we die, we all meet up and we invite Dr. Mack and let me stop. I don't.
And we
eat her brain.
Yeah, I'm down.
I'm gonna edit this out. I'm editing this out. Yeah, we're not getting caught up by the FBI for this shit.
I didn't say a human brain.
Well, motherfucker, if we ain't eating a human brain, what are we talking about?
Don't they eat monkeys in different parts of the world?
Why are you talking Indiana Jones right now? What? You saw that in Indiana Jones.
I want some monkey brains.
You're like in India, like
yeah. Girl, she's subcontinental, motherfucker. International.
The brains of animals are featured in French cuisine, and I'm French. I should have known that. China, India, Mexico, Pakistan, Indonesia, Philippines, Cuba, and Cameroon all eat brains.
Oh, so maybe we need to try one of them delicates. This motherfucker look like a McRib.
I'm just gonna clip in the Indiana Jones frozen monkey brains. Because that's what he does. He eats frozen monkey brains.
Hello, Clarice.
Eat animal brain.
Hey. Well, anyway. To all you that are autistic and very highly sensitive, I'm so sorry for this podcast.
Sorry. This was not your podcast.
This was not yours. Me and Spence might do a trigger warning for this one. For at least
we usually do.
We do. It's in the thing. Spence, you got any more sauce before we end this? We're going to end this like we normally do, and then we're going to start the next one. If you have time. We'll get into that in a second.
I do have time. I just might need a bathroom break.
Yep.
Oh, yeah. Of course. Okay. One last question. Are there any serial killers that like you just feel like you are like you really want to know more about? It's not that you like them.
You would like to talk to
favorite them. Like which one do you feel like? It could be fictional too. If you have a fictional one, that'd be great. If it's Hannibal, all right. But like, do you have any that you're kind of intrigued about?
Yes. So my favorite serial killer, and when I say favorite, just like you just clarified, I mean from a clinical perspective.
You're like,
Yeah. Clinical, criminological perspective.
Yes.
Nobody actually likes a serial killer. Is the Night Stalker, Richard Ramirez.
Oh, yeah.
So you know why he's so fascinating to me, and the FBI agents that profiled him talked a lot about this, is because like no one was off limits. His, usually people have an MO and they have a certain kind of victim. His victims were like black, white, gay, straight, old, young, children, women, men, like, and that's one of the reasons they had such a hard time finding him. because he
Yeah.
just like, and his methods of killing were like knives, guns, drugs, strangulation. So to me, he's fascinating because, you know, people always think forensic psychologists are FBI profilers. We're not. We're completely different. But I've heard FBI profilers talking about him, and they were like, yeah, he was so hard to catch because he used any method. Anybody could be a victim. I think his victims ranged from like age like 4 to 80 something.
Jesus.
And all different ethnicities, all different socioeconomic backgrounds, all different like genders. He killed transgender people, if I'm correct, prostitutes, children, old people. So anyway, all that to say, to me, that's fascinating because most serial killers, even the ones that we know as laymen, just from, you know, watching true crime, they have a
Yeah.
type. And the way
Yeah.
they kill it, they have a type, they have a way. But
An MO.
Yeah, an MO. But he was like all over the place. So
Mm.
that's my clinically, criminologically fascinating serial killer.
Crush. Mm-hmm. There was
He was so cute too.
He
There-
had something.
American
Yeah,
Horror
dimple.
Story. They actually added him in one of the seasons. It was like the
Oh, really?
1987, yeah, where he was one of the murderers in it.
He's just
It's the
Fascinating.
throwback season when they're like at this camp, and then he's one of the Night Stalker. He's in there slashing people up.
Night Stalker.
Yeah, American
Yeah.
Horror Story. I forgot what season. It was like 5, 6, 7, something like that. 7.
And he was also a rapist. He was also a sex offender.
Yeah.
So, yeah, he was just murdered 14 people, tortured people, sex offender, just all over the place. Like,
Yeah.
So,
sure.
so for a lot of folks listening, I mean, this would be a little traumatizing, but I feel like the vibe is a lot of serial killers are men, and I feel like a lot of the victims are usually women. Correct, or am I wrong, way off on that algorithm, that statistic?
Yes, you are correct. The majority of serial killers are men, although there are some female serial killers, or a lot of female serial killers act in accordance with, not in accordance, in conjunction, like a
Yeah.
Bonnie and Clyde
Yeah.
with men.
Yeah.
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 And
Yeah.
unfortunately, most victims of violence are female.
Yeah, yeah,
So that spans into,
all this stuff.
serial
Magnificent. To be a woman. Hooray.
yeah,
Huzzah. Interesting, bro.
especially in a male-dominated field
Yeah. Yeah.
with a big mouth.
They must love you.
Oh my
They must-
God. They just you're next on the butcher block for a couple of motherfuckers. Let's be real. Like motherfuckers, not in a perverted way, have fantasized about cooking your ass. Cooking.
Probably.
100%. Yep.
Like, I'll
Yeah,
get it.
I think my
Okay.
patients
Love
love
you.
me. Do the
Yeah.
judges and the attorneys love me? Probably
Oh yeah.
not.
Yeah.
No, probably not. Yeah, probably
No.
not.
Some do, because I do.
Yeah.
Some do. You know, you got a little bit of everything. Just
You
like
have a
every-
little defense in there. Yeah. You got defense, you got offense, you got the whole deal.
You
You're
got-
like
you know.
LeBron James of
You could have picked a
never gonna
woman,
be like
the
that.
Michelle
Mental health.
Obama of mental health.
Maya Moore of
Maya
mental
Angelou.
health. There you go.
Yeah.
Maya Angelou.
I don't know. She's good, right? The
I'm
male
talking
hooks.
offensive. I'm talking sports, and you're
Oh,
like,
sport. Well, I was trying to get off sports. Serena Williams.
there you go, Serena Williams of the mental health field.
Is there any
There you go.
Indian athletes? Well, we ain't naming all black women.
Yeah, it's true. You don't even know.
Yeah, bro. Let's be
You
real.
don't even
Y'all,
know.
y'all ain't the athletic type, bro.
Oh,
Y'all motherfuckers intellectuals.
Got cricket.
polo, cricket and polo. But you know what? My dad is originally Indian, but born and raised in East Africa, Tanzania and Kenya.
Oh,
So
interesting.
Jesus Christ.
I've been to Africa, but I've never been to India, which is kind of sad. But anyway, I digress.
Okay. So I feel like this will be the conclusion of the interview session, which has never
Yes.
been done before in 3 years of this podcast.
No, this is the first time.
Yes.
Number one.
Number one. And I was like, bro, why stop her? Like, just let's all just keep throwing shit on. But I don't want to take up a lot of your time. So we'll talk about that after that, but hopefully we can do this. If not, we can pick another time if you're tired or whatnot. Anything that you would like to promote, and we'll have you do
Yes.
this again, but anything you would like to promote, your practice, clients, you advocate, like, what would you like to
Amazon.
promote? Yeah. What's going on in your life?
So yeah, I actually offer to find me for, professional evaluations, forensic evaluations, my website is RISE, RISE, risepsychological.com. But I also offer trainings in malingering of psychosis and psychopathy, and you can get 3 CEUs if you take them. They're on my website. So if you're a mental health clinician looking for continuing education credits and you're interested in psychopathy or malingering, that's on my website. My Instagram handle is the same. I think it's rise, RISE _ psychological _ services. So just look up Rise Psychological Services. And then the thing I'm the most excited about. Oh, and all any articles I've written or TV shows or podcasts I've been on are linked on my website. So you can find that. But yeah, one of the top 10 shows on Amazon Prime is The World's Most Evil Prisoners. And I'm on that from episode 1 to 5 or 1 to 6. I don't remember.
Woo.
So check that out on Amazon Prime. And I would love that support.
I got a lot of girlies I can push this on. A lot of girlies will eat this up.
Dr. Lina Haji taking over Amazon.
Taking over Amazon.
One show at a time.
Yep. Did my show, motherfucker.
Yeah.
Yep.
I know all about serial killers, son.
All about them. In all their, no, I won't stop. In all their refrigerated parts.
Don't do it. Don't do it.
I'm not going into it.
He's like, I'm not doing it.
In all their big bags.
There it is.
There it is.
There it is. Always.
Okay. Man.
All right. So this is the end of part 1, folks. Part 1. Thank you, Dr. Lina Haji, for doing the parts. We really appreciate it. And thank you for coming on. You've been a great guest. And yeah, Naz, anything before we go?
No, that's it, homie. Let's take a break and then we'll figure out what we're going to do. And hopefully all of you can, enjoy what we just did. But now we'll actually get into the show of Hannibal and then pick her brain on how it just sees all this and visualizes this, intellectualizes this, and experiences this. So everyone, thank you for listening.
Yes.
Much love. And remember, take care of yourselves.
Or don't.
It's completely up to you. Peace.
Look out for part 2.
Duh.
It did.
Let me.